Hello, welcome back. Today in this video we are going to learn the lymphatic drainage of breast. First, let us see the nodes draining the breast. Lymph nodes draining the breast. What are the lymph nodes? First we have the axillary nodes. Then we have internal mammary nodes. Internal mammary nodes. Then there are posterior intercostal nodes. Posterior intercostal nodes. Then cephalic nodes and some nodes drains into subdiaphragmatic and subperitoneal nodes. Okay, now you know axillary lymph nodes are of different groups, right? So we have anterior axillary lymph nodes, then there are posterior axillary lymph nodes, then there are lateral groups, then we have central groups and apical nodes. Okay, among these axillary groups, major part of the lymph goes to the anterior axillary lymph nodes, directly drains into anterior axillary lymph nodes. Now look at this diagram. Okay, so we have the axillary lymph nodes here, then we have internal mammary nodes and intercostal nodes. Okay, about 75% of the lymph from the breast drains into axillary lymph nodes, 20% goes to internal mammary nodes, and the remaining 5% drains into intercostal nodes. Clear? Now, the lymphatic drainage of the breast can be divided into, two groups. So we have superficial lymphatics and deep lymphatics. Superficial and deep lymphatics. Okay, so the superficial lymphatics drains the skin of the breast, except, remember, except nipple and areola. Okay, so the lymph from the skin except the nipple and areola is drained by the superficial lymphatics, whereas the deep lymphatics drains the parenchyma of the breast. You know what is parenchyma? Parenchyma means the glandular part. Parenchyma of the breast, nipple and areola are drained by the deep lymphatics. Clear? There is a term called subareolar plexus of Sappey. S-A-P-P-E-Y. What do you mean by subareolar plexus of Sappey? Subareolar means deep to the areola. Okay, that means a plexus deep to the areola. Okay, so what do you mean by the subareolar plexus of Sappey? That is, a plexus of lymph vessels deep to the areola is called as the subareolar plexus of Sappey, and the most of the lymph from the subareolar plexus of Sappey is drains into the anterior axillary lymph nodes. Remember, anterior axillary lymph nodes, right? Now, this particular superficial lymphatics of the breast of one side communicates with the opposite side. Remember this point. The superficial lymphatics of one side communicates with the other side. Remember this point. Okay, suppose the superficial lymphatics of the right breast, this is the right breast, is communicated with that of the left breast. Consequently, there is the chance of bilateral malignancy. Unilateral malignancy may lead to bilateral malignancy. That means if there is a carcinoma of the right breast, as the superficial lymphatics communicates with the other one, so the malignancy may go to the other side, to the left side. Okay, remember this point. Now look at this diagram. The breast can be divided into 4 quadrants. We have upper medial quadrant, lower medial quadrant, upper lateral quadrant and lower lateral quadrants. Right? The lymph from the lateral quadrant drained into anterior axillary lymph nodes. So here, this is the whole is the lateral quadrant. I am drawing for this one. So upper lateral quadrant and lower lateral. Most of the lymph from this particular quadrant finally drains into anterior axillary nodes. Here we have the anterior axillary nodes. AN means anterior axillary lymph nodes. Right? And from the medial quadrant, we have upper medial quadrant here and the lower medial quadrant. So from this area, okay, drains into, so here we have on either side of sternum we have parasternal nodes, or it's also known as internal mammary nodes. So lymph from this area drains into internal mammary nodes, okay. So here you should remember one thing. So this is a midline. Suppose this is the right side and this is the left side. Okay. So some of the lymph from these internal mammary nodes may crosses the midline and go to the opposite side. So it may lead to bilateral malignancy. I already mentioned that. Right? Then some lymph from the lower lateral quadrant, okay, lower lateral quadrant goes into the posterior intercostal nodes. Remember this point, important. Posterior intercostal nodes. Some lymph from this lower lateral quadrant goes to the posterior intercostal nodes. And some from the lower medial quadrant. This is a lower medial quadrant, right? Goes it. So here we have the diaphragm. Okay, so diaphragm, below the diaphragm we have the abdomen. Okay, so some lymph from the lower medial quadrant goes to the abdomen. So below the diaphragm we have subdiaphragmatic nodes. We have subdiaphragmatic nodes. Then we have subperitoneal nodes. Subdiaphragmatic means below the diaphragm. Subperitoneal means inside the peritoneum or inside the peritoneal cavity, there are lymph nodes are there. So it goes to here to the subdiaphragmatic lymph nodes. Right? And I told you major part of the lymphatics drains into anterior axial lymph nodes. Okay, from the anterior axial lymph nodes, lymph goes to the central group of lymph nodes. We have central group of axillary lymph nodes. Okay, from the central group that goes to the deltopectoral or cephalic nodes, and finally goes to the apical nodes, lymph nodes, apical axillary lymph nodes. Okay, remember this. Now, I told you some lymph from the lower medial quadrant of the breast goes to the subdiaphragmatic nodes and goes to subperitoneal nodes. Okay, and the lymphatics enters into the abdominal cavity. Okay, sometimes what happens actually, the carcinoma of the breast passes through this subdiaphragmatic lymph nodes, reaches the abdominal cavity and finally goes to ovary. And makes secondary tumor there. And the secondary tumor forms there is known as the Krukenbach's tumor. Remember this point, the secondary tumor formed in the ovary is known as the Krukenbach's tumor. Krukenbach's tumor. Now, carcinoma of the breast. Most common cancers in the females. Okay. And the clinically, the carcinoma of the breast presents some features. The first one is painless lump. And breast, female breast is a mobile organ. Okay, so in carcinoma it become fixed, it become immobile. What is the reason? What happens? It is the breast become fixed because or due to the infiltration of suspensory ligaments. Suspensory ligaments. See here, just I am drawing the breast. See here, we have the breast. So here we have the clavicle. Over the clavicle, we have the pectoralis major muscle. So here we have the pectoralis major muscle, and this is the D fascia. Okay, it is like this. So we have so many glands are there. This one. Okay, so from the D fascia, there arises some ligaments. There are some ligaments, and these ligaments are known as the suspensory ligament of Cooper. Suspensory ligament of Cooper. Okay, so these suspensory ligaments. So these are the suspensory ligaments. These suspensory ligaments anchors the breast into the deep pectoral fascia. This is the pectoral fascia. Pectoral fascia. Okay, so why the breast become fixed? When this carcinoma infiltrate the structure, when it get infiltrated, so this fibrous nature of the suspensory ligament will be lost. So there is no mobility and the breast become fixed. Is that clear? Now, next feature is there is the retraction of skin. Retraction of skin. Another is the retraction of nipple. Retraction of nipple. And what is the reason for the retraction of nipple? Retraction of nipple is due to the infiltration and fibrose of lacticiferous duct. Okay, so here in this picture you have these lacticiferous glands and the duct. This lacticiferous duct opens into the nipple. Okay, when there is an infiltration of this area, what happens? It pulls the nipple inside. Okay, suppose this is the breast, female breast. So nipple become infiltrated because this structure, what is that? That is the lacticiferous duct become infiltrated. As a result, it pulls, the elasticity will be lost, it pulls the nipple backwards and the nipple will be retracted, right? Because of all these characteristic features, the skin of the breast appears like that of orange peel. Orange peel, you have seen the skin of orange, right? So the skin of the nipple will become like that of orange peel, and that appearance is known as the body orange appearance. In examination they may ask body orange appearance. Okay, so because of this whole appearance, so here what is this body appearance? It is the appearance of breast like that of orange peel in case of carcinoma of the breast. Okay, the reason, when the cancer cells blocks the lymphatic vessels in the skin of the breast and lead to the accumulation of lymphatic fluid. So this accumulation causes the skin to swell and form pitted dimple structure like that of an orange peel. So that condition is known as the body orange. And that was a few points regarding the lymphatic drainage of the breast. It was very simple. and hope you understood. If you find the video useful, please give a thumbs up and share it with your friends. And if you have any doubt, please do comment below. Thank you.